you were told you have severe vertebral artery stenosis, you see the word severe and panic. Is a stroke coming? Do you need emergency surgery? Let's clear this up today. Hello everybody, I'm Dr. PK, and now today we are talking about what vertebral artery stenosis means, when is it dangerous, when it is not dangerous, and when surgery or stenting is actually needed. This can prevent unnecessary panic and also prevent missing a stroke warning sign. What is the vertebral artery? So you have two vertebral arteries. They run along the back of your neck and join to form the basilar artery. Today, they supply brainstem, cerebellum, and occipital lobes, which is all behind. This is called the posterior circulation of the brain. So if blood flow is reduced, symptoms will affect balance, vision, speech, and coordination. Not usually classic facial droop or arm weakness like we see with carotid strokes. So your balance affected, coordination is affected, speech is affected, vision is affected. What does severe stenosis mean? Stenosis means narrowing. Mild is less than 50%, moderate is 50 to 69%, severe is more than 70%. But here's the key. The number alone does not determine danger. What matters most, are you having symptoms? When is it dangerous? Vertebral artery stenosis becomes concerning when it causes a posterior circulation ischemia, lack of diminished circulation. So what will happen? What kind of symptoms? You're going to have sudden dizziness, vertigo, double vision, slurred speech, difficulty swallowing, sudden imbalance, drop attacks, sudden falls without losing consciousness, weakness, numbness. If this occurs suddenly, this is a stroke emergency. Call emergency services immediately. What if there are no symptoms? And that is very common. Many people discover vertebral artery stenosis in CT angiogram, MRI, carotid ultrasound, incidental imaging. If there are no symptoms, treatment is usually medical therapy, not surgery, and that includes antiplatelet medication like aspirin or Plavix, clopidogrel, high-intensity statin, blood pressure control, diabetes control, smoking cessation, lifestyle changes. In many cases, that is sufficient. When is surgery or stenting considered? Surgery or endovascular stenting may be considered if recurrent symptoms despite optimal medical therapy, high-grade stenosis with poor collateral circulation, bilateral severe disease, evidence of repeated posterior circulation stroke. Even then, decisions are made carefully by neurologists or vascular surgeon or neurointerventional radiologist. This is not automatic, and it's really an emergency unless stroke symptoms are active. Why some people don't need surgery? The body often develops collateral circulation. This means other vessels compensate. So even with 70% narrowing, blood flow may still be adequate. That's why imaging plus symptoms together determine management. So here's a simple rule. Severe narrowing without symptoms usually needs medical management. Severe narrowing with sudden neurological symptoms, emergency evaluation. So do not panic over the word severe, but never ignore new neurological symptoms. Your brainstem controls life-sustaining function. So you gotta respect symptoms. So thank you for watching. And if you like the video, please share and repost. We'll see you in the next video.